All right, let's dive into US healthcare post-pandemic specifically. What's happening with jobs and wages? We dug into the data and, well, it's not what you'd expect.
Yeah, not at all. Everyone assumes healthcare just bounced back after COVID, that it's, recession-proof and all. But this analysis tells a different story.
Right, like it says healthcare employment actually dropped at the start. I mean, did people stop needing doctors all of a sudden?
It's more complicated than that. Think about all those elective surgeries, knee replacements, cataract stuff. Those got postponed like crazy. Plus, people were avoiding hospitals unless it was a dire emergency.
Makes sense. No one wants to be around sick people unless they have to be, so healthcare demand basically fell off a cliff.
Exactly. A total demand shock. Something unheard of in this sector. It did rebound faster than other industries though because, well, it's essential. But it's not back to pre-pandemic levels quite yet. Skilled nursing and elderly care facilities. They're getting hammered.
Really? You'd think with the aging population, those would be booming. What's the deal there?
You'd think, right? The problem is they got hit hard during COVID and are dealing with the same labor shortages everyone else is. But worse. Way worse.
Huh. So we've got some parts of healthcare thriving, others struggling. What does that mean for wages then?
Desperate times, higher pay.
You're not wrong. Overall, healthcare wages are up, and significantly so. But, and this is where it gets interesting, it's not all sunshine and roses for healthcare workers.
Wait, hold on. How can wages go up but it not be good news? Explain it like I'm 5.
Imagine you and your friends average your allowances. The friend with the least money moves away. What happens to the average?
It goes up, but no one actually got a raise.
Okay, I see what you're getting at. The overall healthcare wage increase might not show what's happening to individual workers.
Exactly. One factor is that tons of lower-wage healthcare staff left during and after the pandemic. Burnout, lack of childcare, better options elsewhere, you name it. So yeah, the average goes up, but it's not like everyone's suddenly rolling in dough.
That is fascinating. So when I see a statistic about how much wages increase for, say, someone in a nursing home, I shouldn't assume it's all rosy.
Let me tell you fast. We got to look deeper. Between February 2020 and January 2024, skilled nursing facility wages went up by a massive 26.5%, 26.5%. Now those are celebratory numbers.
Impressive.
Right. But here's the kicker. During the same time, physician office wages only increased 12.3%. Quite a gap.
Whoa, yeah, that's a huge difference. You're saying there's way more to this story than just healthcare wages are up.
Bingo. And that's what we're here to unpack. All right, so we've got some parts of healthcare recovering, some lagging behind, and wages all over the map. Well, think of it this way. Policies like Medicare and Medicaid reimbursement rates, they directly impact how well healthcare providers are doing financially. And for those struggling nursing and elderly care facilities, that's make or break stuff.
Right. Because if they're not getting reimbursed enough, they can't pay their staff competitive wages. And then it's even harder to keep people around, let alone attract new hires. Vicious cycle.
Totally. Like trying to bail out a sinking boat with a teaspoon, then add in regulations on top of that, like staffing ratios in nursing homes, which, yes, are meant to ensure quality care. But when you're already short-staffed, it's tough.
So are these policies part of the problem then?
It's not about placing blame. It's about understanding how complex this all is. You want good quality care, affordable care, and fair pay for healthcare workers. It's a balancing act. And government policies have a huge influence on how that plays out.
Okay, that makes sense. So we've got the pandemic's aftermath, workforce shortages, wage pressures, government policies. It's a lot to wrap our heads around. What's the bottom line for the average person who relies on the healthcare system?
It means we have to be having these conversations. We need to be informed about these trends and how they could affect our access to care down the line. Because this isn't just numbers on a spreadsheet, it's about people's lives and well-being. Well, necessity is the mother of invention, as they say, and we're seeing that play out in healthcare right now. Some really innovative stuff is coming out of all this.
Like what? Give me some examples.
Telehealth. For one, it's absolutely exploded since the pandemic started.
True. I've even used it a couple of times myself. Not perfect, but man, is it convenient.
Exactly. That convenience, it's a game changer, especially for people in rural areas or underserved communities who have trouble getting to a doctor.
Right. Breaking down those barriers. Telehealth, that's a big one.
What else? Remote patient monitoring is another exciting area. Basically using tech to keep an eye on patients with chronic conditions, even when they're not at the doctor's office.
Wow. Like a virtual health guardian angel. It's got to be so helpful for folks with, say, diabetes or heart conditions.
Exactly. And it speaks to this larger trend of tech really stepping up to reshape healthcare.
It's amazing to see. Honestly, though, I got to say, I came into this thinking healthcare was pretty much back to normal after COVID. But it's way more complicated than that.
Way more. There are some hurdles ahead for sure. But there's also this feeling of, adaptation, like the healthcare industry is evolving, finding new ways to do what it needs to do.
Resilience, innovation. I like the sound of that. Well, there you have it, folks. We took a deep dive into U.S. healthcare after COVID. The good, the bad, the uncertain, it's all there. But the conversation, it doesn't stop here, right? What can you, the listener, do with this information?
Exactly. These trends, they're going to keep shaping healthcare for years to come. So it's up to all of us to stay informed, to get involved, and to fight for a system that works for everybody.
Couldn't have said it better myself. So as you go about your day, think about this stuff. The future of healthcare. Will these trends lead to a system that's more equal, more accessible for everyone? Or will they just make existing problems worse? It's a question worth asking.
And on that note, that's your deep dive for today. Until next time, stay curious, stay informed, and most importantly, stay healthy.